know, there's things in this town that everybody just knows. Everybody knows that drugs are too expensive, pharmaceutical drugs, that is. You can actually get the other kind of drugs pretty cheap in some neighborhoods. Pharmaceutical drugs are too expensive, and it's all Big Pharma's fault, or it's all Big Health's fault. It's the insurance company's fault. It's certainly not the government's fault. And the only solution, of course, is a single-payer healthcare system where we all have to act like we're Canadians, right? That's what everybody knows. Believe it or not, that's not completely true. There are some solutions to high drug prices, and we're going to talk about one right now with Marie Buerkle. Now, she's a former congresswoman, former commissioner of the U.S. Consumer Product Safety Commission, and she's also a nurse, and she joins us now. You know about all angles of this, right, as a healthcare provider, but also as a legislator.
That's right, and I actually ran for Congress because of the Affordable Care Act, so we can talk about that.
There you go, which was also supposed to solve all these problems.
Exactly.
Okay, so drug prices are too high. I mean, you know, you always see this is how much this will cost in America, but in another country it costs, 10% that price. So what can we do about that?
So first of all, always the free market. Patient-centered, always the free market. And so what we want to talk about today are what's called a pharmacy benefit manager. It's an entity or a group of people who manage pharmacy benefits. And when they do that, they promote patient safety, they reduce cost, and they have healthier outcomes for that patient.
Pharmacy benefit manager, PBM.
Yes.
I've seen this around, right? And is this basically, instead of me going and buying drugs, and it's just me, and you know how the market works, I don't have a huge negotiating ability there. These guys are negotiating those prices on behalf of a ton of me's, like thousands of
Exactly.
me's.
For an employer, for the government sometimes, for unions, they negotiate the cost of that drug on behalf of their group of people. Mm-hmm. Now that's something maybe pharma isn't all that fond of, because if there's a way, they use that leverage in all their members to reduce the cost of drugs. And ultimately, as they're looking at what the patient is receiving, if there's a generic that works better, works more just as efficiently as that name brand, right, they'll suggest that generic to the patient, also lowering the cost of drugs and cost of health care.
So I thought insurance companies already did this. I thought this is something that either HMOs or PPOs are already sort of engaged in because they're able to negotiate on behalf of all of their members.
So they look at more of the health care rather than the pharmaceuticals and the drugs the patients are receiving. What a PBM does is, if Larry O'Connor goes into a pharmacy and gets maybe the 5th prescription the doctor's written, they look at all those prescriptions, they make sure that nothing counteracts with any one of those prescriptions, they make sure that you're taking it, they understand your usage and you're renewing their prescription, so they look at patient, which helps for patient healthier outcomes.
But by the way, just so you know, since you're a nurse, I'm only on performance-enhancing drugs like steroids, human growth hormone. I got to maintain the physique, right?
All right.
So this seems like it's a win-win for everybody but the pharmaceutical companies. So it should be, because everyone likes to tick off the pharmaceutical companies, right? So why isn't this a no-brainer for the government to jump on board with?
PBMs are kind of behind the scenes. So when you go pick up your drug, you're not understanding that someone's managing behind the scenes, making sure you're getting the right drug, making sure you're renewing your prescriptions. So PBMs are not that well understood, and I think what our job needs to be is to get the word out, the benefits, the amount of money they can save the government, and do save the government when they're utilized.
So if a consumer wants to engage one of these PBMs to work with, especially if they have chronic illness or they have a lot of prescriptions, things like that, is this something that's in the marketplace? Is this a layer that they would get on top of their health insurance coverage or their HMOs?
So the PBMs negotiate between a union or a government or a carrier, a health plan,
or maybe a
with the
big
pharmacies.
corporation.
Exactly. If they have a self-funded insurance program, exactly right. To help them lower their costs and to make sure they have good patient outcomes.
So, all right, let's play this out for a minute because we know how DC works. So as you've laid it out, this seems like it's good for the consumers, as I said, and it lowers costs and it fosters competition. Pharmaceutical companies don't like that, and they're also pretty well connected in DC, as we've learned over the last several years. They're able to win a lot of legal battles and it enriches them. So I'm guessing they're employing their lobbyists to get Congress to stand in the way of these PBMs.
They are, but I will say this, Larry. What we all need to do is come to the table, because demagoguing a PBM or demagoguing anything is not going to be best for patient outcomes and for the patient. So we've got to be patient-centric, and we've got to get all the stakeholders at the table, not the government, but all of the stakeholders, to figure this out and to really, and our job needs to be explained to the legislators, these PBMs have real value for the patient, for the cost of health care, and so don't demagogue them, don't fall prey to the lobbyists, rather pay attention to the value they bring to a patient.
There's a rule in DC political media, and we certainly subscribe to it here on O'Connor Tonight, and that is we can't have a conversation if we don't talk about the 2024 presidential election, and most specifically Donald Trump. This should be an issue. This could very easily be a winning issue for a candidate for president. President Trump has talked about his efforts when he was in the White House to lower prescription drug prices. Do we know where he stands on this, if he's already sort of signaled that this is a good idea?
Quite honestly, President Trump had an executive order to eliminate PBMs, but it came back from the nonpartisan CBO that it was going to cost the government a lot of money, $170 billion over a 10-year period. And we've seen just recently Governor DeSantis taking some...
That's the subset of the rule. After you're done talking about Trump, you need to bring up DeSantis. Yeah, so all right, so where's DeSantis on this in Florida?
So he's not condemned PBMs, but he's trying to remove some of the quivers, some of the bargaining chips that PBMs use. And Governor DeSantis, just like President Trump, are populist leaders, and they want to do what's best for their constituents. I truly believe that. They don't want to put the thumb of government on the scale. And so I think really that that education piece becomes critical to make sure they understand the value of PBMs. It helps the patient, it helps the cost of healthcare.
So then the education process obviously filters down to the consumers and voters, and then a good politician, figures out which way the wind's blowing.
That's
so
right.
What can we do? What should we do, either dealing with our insurance companies, our employers, or our representatives with regard to these PBMs, and making sure that they have a stake in making sure that we don't have to spend as much on prescription drugs?
I think it's incumbent upon all of us to make sure, as a patient, as a consumer of healthcare and of pharma, to make sure your legislator understands the value of a PBM. Don't eliminate them. They're the only entity in that supply chain of pharmaceuticals that cares about the cost and reducing that cost. So they're a real important part of that.
Explain this to me, because I think I know the answer, but what is the rationale for excluding them, other than they're cutting into everybody's profit? That's it?
I think you've said it pretty well.
That's it.
That's
They're
right.
The only rationale that they're giving. I mean, do they even try to? I was about to name a pharmaceutical company. Does Big Pharma even try to explain why they're detrimental to?
Well, you'll often hear a PBM referred to as the middleman. And there's also a concept that middlemen increase the costs, when in fact this middleman, this person who's negotiating for lower drug prices with pharma, reduces the
That's
cost.
ridiculous. It's like hiring a real estate agent to negotiate the cost of a house down, and you don't want the middleman. Well, the middleman just saved me tens of thousands of dollars.
That's right.
All right, I get
That's
it.
right.
Thank you. Thanks for explaining this to us like
Thank
we
you.
don't, like we're dumb, because, well, let's face it, I'm not the smartest person in the world about this stuff. And now you know, PBM's not a bad thing, and maybe a smart politician running for president next year might want to jump on this thing and make it their pet issue. Just saying. More to come on O'Connor Tonight. You're watching Salem News Channel.